It makes your job so much easier if you can learn effective communication. And so it's always been a goal of mine to continue to work on that.
Now, in the book, and you mentioned about those trigger points sometimes you have with a person and addressing that. And once you know those trigger points, coming up with a rational plan of communication. Can you connect the dots to me? Because sometimes I do have trigger points, sometimes in life. And that's a part of our chapter is dealing with difficult people. And who knows, some people may say I'm the difficult one. I don't know. So can you connect those dots of what are those, those trigger points and coming up with a plan of communication and a plan of action?
So one of the first things I do, if I have an interaction with somebody that I don't think went well, then I really take time for self-reflection to sit down and say, okay, what was it that he or she said that evoked such an emotional response from me? Because part of the process is not only knowing the other person's trigger points, but your trigger points as well. So, for example, I meet with a lot of students in my current position, and they will come to me and, for example, they'll say, my clinical instructor gave me feedback and it really upset me. And I know that if I say anything to her, she's going to retaliate and fail me for the course. So that is one of my trigger points because I find it very distressful that students think that that's the mentality of any faculty, that they want to just, they give you some kind of feedback that is hoping to inspire growth, that they will automatically think, oh, they just want to fail me in the course. So what I do is I stop and I listen, and I realize I have to deal with the perception of the person, because that's their reality, whether there's truth in it or not, but that is their reality. And what I do is I listen to her, I reassure her that I don't in any way endorse that kind of learning environment from any of our faculty. And if she can give me specific examples of when she felt she has been attacked, then I will address it with the faculty. But if she doesn't have any examples and it's just a feeling that she has, then I work with her to talk about how she can address these concerns. So I would give her the words. I'd say, you go back to your instructor and you say, Ms. Smith, the other day when you said I wasn't prepared to give medications, I felt as if you were saying that I was lazy. Was that your intent? So this way you allow the student to address what's bothering them with that person without hopefully putting that defensive person immediately on the defensive. And so those are kind of the things I try to instill in people, because the more you practice that, it's a lifelong skill. And I tell her when she's out there working as a nurse, she will interact with many patients, families, other healthcare providers that also may trigger her points, or the patient isn't feeling well, they're upset, and she comes in just to give a medication. She may receive the brunt of their anger. And so the more you can learn to get a perspective from the other person, but also realize where you're coming from, and then come up with a plan together to have constructive, thoughtful communication, hopefully it would be a much more successful encounter.
That is so true, because what you're talking about is not just a skill or a strategy for college, it's a life skill. As you said, there's life after college and jobs and careers. And these kind of tools and strategies can help you in your careers and even in your personal life and
Yes.
communication with others. So definitely great life skill. Thank you.
Well, thank you so much for sharing that and for sharing the perspective that it's not just about the trigger points of the other person. It's really, equally important, at least, is taking that time and prioritizing, taking that time to think yourself about what was triggering you. And as I think about that, I think that tip in and of itself would have, helped me when I've experienced, interactions that didn't go so well. So I really appreciate that. And I wanted to, talk a bit more about trigger points. And I know that what you you've advised me before to think proactively prior to a conversation. What is your goal about that conversation? What are you hoping to happen? And in articulating the goal, you give yourself more of a chance to be pursuing, mindful of that goal during the conversation, rather than allowing yourself to get derailed and distracted by your trigger points. So can you expound more on that, so that us as beginners, or so that somebody who's never tried to do that can actually successfully use that strategy of articulating a goal?
So I tell people, excuse me, when you need to have a conversation with a person, then maybe you're kind of dreading having that conversation. There are three goals for the outcome. One is you want that person to apologize. So if that's your thought process, it doesn't necessarily always go very well, because now you're talking about controlling somebody else's response to you, and you have no control over the other person's response. So wanting them to apologize is not always a win-win. Second potential goal would be to have a compromise. And depending on the topic, that might be the correct solution. The one that is always a win-win is if you let that person know how their actions and their words made you feel, then that is always a win-win, because they cannot argue with you, because those are your feelings and your emotions. So those are usually the three things that I say to people when they have to go and talk with other people. So one of my roles, I used to be a clinical nurse specialist in a hospital, and nurses would come to me with complaints about another nurse. And I would say the same thing I just shared with you all. And then I said, then if you can't get resolution, then come back and talk with me. And one day I knew I'd really made the point, because I was standing at the nurse's station, and one of the nurses who had spoken with me came up to me and said, well, I haven't talked to that person yet, and I decided I'm just not in the mood for confrontation. And I said, okay, well then you know what you can do now then, right? And she said, what? I said, stop talking about it. If you're choosing not to address it, then just stop talking about it. You're making that decision not to talk with that person. So now you need to move on. I'm not really sure she liked that response, but I also made my point that then, okay, I'm not going to magically step in and try to correct everything for them. They need to, as two professionals, work it out together.
Mm. It's really sounds like great magic, because people do avoid talking directly to another person for whatever reason. And you had mentioned that person didn't want a confrontation, but she didn't even try. How did she know it was going to be a confrontation? Because she never tried
Right.
to talk to that person directly. And some people feel more comfortable talking to others rather than confronting. I don't know, and that's could be very normal, that people don't want to talk to someone directly, and they rather talk to and vent. I guess some people call it venting to someone else rather than talking directly to the person you're venting about. And I'm glad that you did that, because that's taking ownership for that person and accountability for them to address the issue, instead of I want you to address it, even though it's my issue and my concern, but I want you to step in and solve it for me. So I'm glad that you did that. And once again, that's a life skill. It's instead of just saying, I'm going to step in and solve all your problems. No, I want you to be able to do this, because one day I may not be around. And what if you have an issue with someone else? How would you address it? So, that's wonderful that you let that person take accountability and responsibility for that. So can you address, I guess, we get into the emotions, I guess, of things of the moment sometimes. We let our emotions take over. And I guess there should be more checks and balances that we should put to, and self-restraint sometimes, that triumphs over those zingers that we may want to give somebody. So can you address where we try not to let emotion take over? We still want to communicate, but not coming off being very, emotional, where you get so much into the emotion and the zingers you want to give somebody, and practicing self-restraint a little bit?
So I'm not going to say that I'm always 100% great at doing this, but the goal is a couple tips. One, sometimes when I'm in a conversation with a person, I feel like we're just going in circles. And so then if you can recognize that, you need to stop and say, okay, what is it that you're asking of me? Or what is the main point that you want me to take away from this conversation? Because now you're helping to redirect that person to really, what is it that you want me or that person to know? Another thought is be aware of all the things that can happen. Like if I were a supervisor and I called an employee and I had to talk to them, let's say about their attendance, for example, and they start going off track, okay, they're deflecting. So you have to recognize that and say, okay, I hear what you're saying, but I'm going to bring you back to the attention at hand. This is what I asked you. This is what we need to talk about today. And lots of people deflect without even meaning to. They just kind of go off on a tangent. So if you're aware of that, if you can help to bring people back to the point of what you're talking about, I think that can help to keep things focused. And also, again, self-awareness. If you know that you're just getting more and more upset in the conversation, then you know it's time to stop the conversation. And I read, and I don't remember the resource, but I read once somebody said, if you feel so upset and you realize that you shouldn't continue on, you can say something to the effect of, I'm going to have to excuse myself from this conversation because I do not like the way this is making me behave. So now you're not putting it on anyone else who's in on the conversation. You're talking about your own behavior. You're realizing you're getting out of control. And so you need to stop the conversation so you can stop the negative behavior that potentially could grow or continue to go out of control. And then on the other hand, though, if a person is not having any self-awareness and they are escalating themselves, then you also, I believe, need to practice saying, this conversation is over. I'm happy to speak with you, but please come back to me when you can talk and express yourself in a professional manner. Because there's no reason why you should stand there and listen to somebody be uncivil, unprofessional. There's no point in that. And it doesn't help that person, and it doesn't help the person who's receiving the information as well. So those are just a few of my tips when you're in that kind of situation.
Yeah.
You have also told me before about listening and what an amazing, tool really listening to what the other person is trying to say, listening for understanding. And I'm wondering if you could, talk to us a bit more about why that's such an effective strategy.
I think learning how to listen effectively is one of those goals I continually work for. And the best way for me to stay tuned into what somebody's saying to me is to look that person in the eye.